Dr. Mancini. Today we're going to cover the process and procedure of facial rejuvenation we do here at the center. So basically what we do start off with is we have the patient, Suzanne. She was so kind to be our model. We start with cleansing the face, and we use a cleanser that the patient applies on the face and wipes down. After the cleansing process occurs, we have the patient lay down in our very comfortable chair. We then apply several different serums. One is a copper and hyaluronic acid mist, and we will apply it over the face area. So you can close your eyes. We do several different sprays here. And these are all serums that are applied prior to the microneedling. Now with the microneedling process, it basically aerates the skin so that when we have the serum applied on top, the serum is able to penetrate much quicker and much deeper than if you were not to use it and just apply it on the skin itself. So we start with the copper and hyaluronic acid, and then what we do is we also add in additional hyaluronic acid here. The hyaluronic acid has been demonstrated to increase collagen, and again, when we aerate the skin and we have it go deeper, it has a much more profound effect. Okay, so we're also applying another coat of the hyaluronic acid on the skin here, and we'll apply it on the face. And then what we do is we apply a light stim serum, and this is going to activate the light stim unit that we apply over the face while the patient lays there with the treatment process. So this here is going to activate the specific lights that will also increase circulation into the area, as well as help stimulate collagen on the face. So what we're doing is we're trying to get a doubling and tripling effect, not just with the microneedling we do, but also with the light stim therapy we apply on the skin. Now we use the derma roller, and we're going to start to aerate the face so we can get the penetration of the serum into the face. And we'll start in the forehead. We just start going back and forth over the area. You doing okay there? We want to overlap the area several times, back and forth. And you'll see a reddening effect. We are stimulating the skin pretty good with lots of stimulation throughout. So the face tends to be a little more red afterward, and that's a natural process, and it does stay like that for a little bit, then it goes back to normal color. But we're going to look like a natural blushing here. And again, just the fact of stimulating the skin with the needles, the micro needles, you are going to get an activation of collagen. Some research shows anywhere as little as 206% up to 1,000% after each session. And we're maximizing it by applying the serums that also have an effect on building collagen. So we're really trying to compound the effect with multiple modalities at the same time. So then what we do is we will apply the needling, and the areas that we're needling are based on the goals of the patient. Every patient has a different focus and goal. So what we will be doing in this case here for Suzanne's purpose is we want to be focusing on bringing up this area here. So what we're doing is we're going to be needling the locations that activate the muscles to help pull up. We will be applying microcurrent on the area, as you'll see in a moment. So pull up here. So we're also going to be needling several motor points on the face to help increase muscle tone, because one of the things that occurs as we get older is we lose muscle tone. And when you start losing muscle tone, the muscles sag, the skin sags, which can lead to not only a sagging look, but also wrinkles. So by needling and stimulating the main muscle groups, you basically pull up the muscle and the skin tightens. So we're affecting wrinkles by not only increasing collagen in the area, but more importantly, we're improving muscle tone, so it's stretching the skin. What we're doing here is we're trying to reactivate the same contour and structure of the patient, as opposed to trying to manipulate it the way we want it. We're going to support it in the way the body was naturally inclined to be for this person or any patient. We're always going back to their original, basically the original specifications in a sense. The points behind the ear, as well as on the side here that we're going to needle, affect both the facial nerve and the trigeminal nerve, which wrap and affect the face. So we're stimulating the nerves that are affecting the muscles as well. So we're hitting it from multiple areas. We're activating collagen through microneedling. We're applying the serum to help maximize it. We're stimulating the motor points to help increase muscle tone. So it's much more of an integrative approach. Instead of just focusing on one area, we're covering multiple areas at the same time. It's relatively painless for the patient, not really anything, any sensation, maybe a little bit here or there, but ultimately the patient's nice and peaceful. And then what we do is we apply a microcurrent to the areas that we want to increase the tone. And basically, we're kind of bringing the face to the gym. So we're stimulating these muscles to help activate them. Just like in the body, when you activate a muscle, it'll tone it, it'll bring it up, it'll increase the pull of the muscle. So what we're doing here, in this case here, we're going to want to have a pulling up effect. So we use what's called a microcurrent. And what the patient feels is a slight little kind of buzzing sensation, which means the muscles are getting stimulated. Again, painless for the patient. Lastly, we're going to apply what's called a light stim therapy. And again, the light stim is a light that we use that's been used actually by astronauts on the moon to grow plants. We're not going to grow any plants here, we're going to grow collagen. So the stimulation of the light over the face, we apply it here. There's no heat, there's no sensation, it's just the light itself has stimulating effect on collagen as well as increasing circulation, which is the key behind a good facial complexion. Okay, perfect. And then we'll have Susan lay here for about 30 minutes, and then we'll be back, and then we'll show you the procedure at the back end of the session.